So it left you with the conversation about nitrous oxide abusers being healthcare personnel. On to what might happen if one is overexposed to nitrous oxide. There are cases in literature, they are primarily health professionals that administer the gas to themselves without proper scavenging equipment, or young adults recreationally using nitrous oxide. So things have happened where abusers have fallen asleep with a full face mask in place, inhaling straight from the nitrous oxide cylinder, that gas can be up to negative 67 degrees below, and so getting fourth degree burns. Pneumothorax, there's a case of that in literature, inhaling nitrous oxide directly from the whippet and actually bursting alveolar walls and death. Individuals who have inhaled or have the full face mask on and then wrapped a plastic bag around their head to maintain that gas in there. So that's from abuse. These overexposure incidents and things that happen in a bad way are because people are using it in a bad way. Exposure periods over a couple of hours, 3 times a week, long term. But chronic exposure, so chronic use, chronic exposure to nitrous oxide can have neurologic side effects, temporary and permanent. Generally, these neurologic side effects will return to, function will return to normal after discontinuation of the overexposure or of the abuse, but not always. So the symptoms are not necessarily immediate. They appear several months into a chronic use period. Peripheral neuropathy, again, numbness, tingling in the hands and feet, tingling in the extremities. Impaired dexterity, lack of strength in the hands, impaired psychomotor function, weakness, clumsiness, lack of coordination, a walk that's become slowed or unsteady or shuffling. There's also something called Lermiti's sign, which is an electric shock feeling on flexion of the neck, electric shock in the extremities on flexion of the neck. So this is with chronic use, chronic exposure of the body to nitrous oxide, these neurologic side effects. Compared to other drugs, nitrous oxide abuse is not a public health issue, right? Tobacco, alcohol, marijuana are really the top 3 drugs of choice and are more of a public health issue than nitrous oxide. There are very few regulations governing the sale of nitrous oxide, and it's just up to the gas distributors to make sure they're selling the drug for the appropriate use to the appropriate people. Just as an additional consideration, there have been in the courts allegations of sexual impropriety made against healthcare professionals after nitrous oxide administration. So there has been an accusation, or there have been considerations, comments, people stating that nitrous oxide stimulating sexual fantasies, and that places a clinician at risk for accusations. So again, will not be happening with you as dental hygienists, but certainly what we say to dentists, an opposite sex patient and operator should not be alone in the office, should not be alone in administering nitrous oxide in the office. Of course, you must control the limit and depth of sedation and avoid weekend emergency visits alone. Last but not least, legal and ethical considerations for nitrous oxide. In Michigan, it is a delegated duty to the registered dental hygienist under direct supervision. right? A direct supervision, the dentist has designated a patient of record that's there, and the dentist needs to examine the patient before the procedure, at the end of the procedure, and the dentist must be physically present in the office at the time the procedure is being performed. So, nitrous oxide is under direct supervision. For you, patient needs to be 18 or older, a maximum sedation of 50% nitrous oxide. And of course, you have to take a class and then take the nitrous oxide exam. Although the law doesn't mandate written informed consent, it is certainly prudent practice to have an informed consent form that the patient can sign, date, and have witnessed when sedation is being provided. Informed consent covers the purpose of the procedure and how it will benefit treatment. So why we're administering nitrous oxide sedation, how it's going to benefit the student this week. When you're administering, the purpose is an educational purpose, right? And how is it going to benefit? Well, it's going to benefit the education. And understanding that there are certain risks involved with the procedure, information on the alternatives to this kind of sedation, and then, of course, the acknowledgement that patient questions and concerns have been asked and answered. Have I answered all of your questions? If your office doesn't utilize a written informed consent, verbal consent must be obtained and then noted in the patient record. So verbal consent obtained, noted in the record. So with informed consent, you're just providing the appropriate information so the patient can make an educated decision about their care. Why are you recommending nitrous oxide and what can the patient expect? There are 4 ethical principles that we as healthcare providers must follow. The principle of non-maleficence, do no harm. The principle of beneficence, we want to provide care that's in the patient's best interest. Is nitrous oxide sedation for this particular procedure in their best interest? The principle of autonomy, all patients have the right to participate in their own healthcare decisions. And veracity, tell the truth with no deliberate omissions or withholding of information. So withholding information is just as untrue as telling an out-and-out lie. So administering nitrous oxide oxygen sedation to a patient just because they like the feeling, they want to feel a little high today, it's been a stressful day, that is unethical behavior. That is not following the 4 ethical principles. That's it. You did it. Thanks for listening and looking forward to seeing you in clinic. Bye-bye.